think we can go ahead and get started with our introductions. Welcome to the last equine seminar of 2021. Thanks for everybody who's been joining us for this year and in the years past. We're excited to have Dr. Delvescovo present to us this evening. Before we do, wanted to let you know we have a really exciting lineup planned for the spring series. Because unfortunately COVID is still a thing, it doesn't look like we're going to be able to do our in-person hospital tour in 2022. But we had an idea to do a video, to produce a video to share with you all. And at the end of the seminar, we're going to have a questionnaire for you that we're going to ask what you would like to see in the equine hospital. So if you want to start thinking about that, or who you would like to talk to, even if you don't know their name, maybe you could ask a question and we could find that certain specialist to answer that question for you. So if you want to start thinking about that, we will pop that questionnaire up at the end of the seminar today.
All right, so I think my next.
Yep.
Yeah.
Yep, go ahead. Yeah, I just wanted the last thing to say is that Lindsay and I, Dr. Goodale and I will be monitoring the chat. We ask that you can put your questions in, but most of them we will be getting to at the end of the presentation. And so now I think Dr. Jillian Perkins is going to introduce our speaker.
You can use the Q&A as well.
All right, well, thanks everybody for being here this evening. I'm Jillian Perkins. I'm the Associate Hospital Director of the Equine and Environmental Hospital at Cornell. And I'm very proud to introduce Barbara Delvescovo to you. She is originally from Italy and did her veterinary degree at the University of Parma and graduated in 2012. She practiced in Italy for a year and then went to Ireland and did an internship at Anglesey Lodge Equine Hospital, and then did a few years of practice in that region as well. And she worked with racehorses, a lot of breeding farms, or otherwise known as studs. And she gained a lot of experience there and decided she wanted to do a residency in large animal medicine, which I'm very glad she did, because she came to Cornell and was a superstar large animal medicine resident. She's extremely enthusiastic, everything horses, and extremely skilled in both her clinical reasoning and her technical expertise, which also leads her into a love of kind of surgery and critical care. So when she finished her residency, she was a clinical instructor, but now she's also working on a fellowship in emergency and critical care and hopes to be doing colic surgeries for you in the future. And just loves doing everything. So we're really fortunate to have Dr. Delvescovo here. She has really expanded our emergency coverage and had, having a faculty person present for cases that are coming in after hours for the hospital. So, but today we're going to focus on our foals and how you can recognize problems with foals, but hopefully they're going to be just fine. And so I really look forward to hearing what Dr. Delvescovo has to say tonight about some of our favorite patients. So thanks, Barbara, for Dr. Delvescovo for being here, and thanks everybody. And we'll have a good time hearing about some foals.
Okay. Thank you so much for the kind introduction and welcome everybody. I'm just going to share my screen. Okay, I hope you can all see my screen. Let me know if that's not the case. So tonight we're going to talk about one of my favorite topics, so foals. So full speed ahead, and what to know about your newborn so that we're all prepared for the upcoming falling season. So salient points of the presentation of the talk would be identifying maternal problems that can lead to high-risk neonates. So know when our foals might have a problem, try to prevent these, knowing what some risk factors might be. and from the maternal point of view, so from the mare point of view. So be able to kind of talk a little bit about what is normal and what is abnormal in your newborn. So get a little bit of experience in what is a normal foal, a normal baby, what a normal baby should do, and instead when it's abnormal. And then I'll focus a little bit on the failure of transfer of immunity, because that's a big topic that can predispose babies to be pretty sick in the immediate future or not that immediate future. And then kind of run through a little bit of the most common pathologies of foals and very briefly about their features to understand a little bit better what they can face when they are not healthy. And as Dr. Perkins said, hopefully they are all healthy and happy for you. So a little bit of when to expect the arrival. So the gestational length of mares is normally 342 days, plus or minus 20. It depends a little bit on the mare. And other important factors apart from individuality are is the fact that colts tend to have to carry longer than fillies, so the sex can be important. And then when you go in the later months of the spring, so later months of the season, the gestation tends to get shorter. And for the same principle, if you put a mare under light, for example, then they have the false impression that spring is about to arrive, and so their gestation might be shorter. So there is a little bit of variability. That is why it's 342 days plus or minus 20. In general, when they deliver the baby before 320 days, then that will be a premature baby. And we will see that they can be very critically ill neonates when they are premature. So that kind of threshold of 320 is important to know. And for the same reason, because they cook too long instead of being too premature, if they go beyond the 360, 65 days of gestation, they can also have problems because they have been in utero for too long. There are some signs that you can recognize before in the days prior foaling, so delivery. The mare's udder begins to fill with milk about 2 to 4 weeks before prior to foaling, and then they tend to wax, so you will see some little pearls of colostrum, yellowish, honey-like secretion just attached to the nipple 1 to 4 days before foaling. In general, you will see other signs like the mare's muscle on the croup and the vulva becomes a little bit more relaxed, but that is normally a little bit more difficult to recognize. So other development and this waxing of the teeth are normally the signs that you will recognize more easily. And then sadly for us, the delivery time has been reported in different studies that is mostly at night and mostly between 10 p.m. and 2 a.m. So they try to be in praise. They try to find the time of the day where they feel the most safe and away from problems and from public. So they tend to fall at night. And I just want to point out the importance of the veterinary monitoring during pregnancies. So if you have a mare pregnancy, very important to involve your vet and talk to your vet even before you decide to get her pregnant, but especially during pregnancy. And this is because the vet exam can highlight and detect high-risk pregnancies, so pregnancies that have a problem, just like in people, problems with the placenta, problems with twin pregnancies, for example. And twins are not something that we welcome in horses, at least, because they carry a lot of complications with them, both for the mare and from the baby. So twin pregnancies are actually a problem, and you want to detect them early in pregnancy, and the vet can do that for you. If you have no idea of the gestational age of the breeding dates, then the vet could give you an idea of how far along in pregnancy your mare is and get you a little bit more prepared for your for the timing of events, that is, the events that are about to come. And then, of course, your vet can give you very precious recommendations on the delivery, the foal care in the immediate post-foaling and afterwards. So make sure you consult with your vet if you have the intention of having a pregnant mare, having babies. And on the same line, like, should I foal at home or should I send my pregnant mare to a foaling facility? I would not recommend you to foal at home if you have never seen a foaling before, you have never dealt with foals before, so you're untrained, unexperienced. If you don't have the possibility of having 24 hours monitoring, so if that's not possible for you, it's not a good idea to fall at home, because you want to be there, and we'll see in a second the stage of the labor, but you want to be there and intervene in case there is a problem. And then if your vet advise you otherwise, it's very important that you listen to your veterinarian's advice. If you decide to fall at home for whatever reason, then again, very important to make a very detailed plan with your vet and have them always on speed dial, especially when the date is closer, the time is closer. So in terms of what to get ready at home, what your mare will need is a clean, safe, quiet space to foal. And horses have been given birth also in the open fields, and this is an acceptable choice. If you allow your mare in pasture, there are some advantages. It's open, it's grassy. If it's clean, it's a fairly healthy environment. However, you do want very often to have them confined, because you want to observe the progress of foaling, and we'll see how important it is to be able to observe and ensure that everything is going in the right direction. And the other reason is that very often the season when they fall, so between January and June, at least in the earlier months, the climate doesn't really play in your favor in terms of having a clean pasture to leave them outside. And then remember, you have a very fragile baby, so you want to provide a good warm environment. So very often your vet will probably recommend you to fall inside, but your vet can recommend you where to fall your mare at best when he comes, or he or she comes to the facilities and see your facilities. In general, we do recommend a big stall, so 14 by 14 feet with good bedding. Normally straw is better than shavings. It's preferable than shavings, because shavings normally stuck to the wet newborn or the mare. The shavings can be aspirated by the newborn when it's on the ground. So straw is better, and make sure that you have nice and surfaces that are easy to clean as well. So the 3 stages of parturition. So how do they deliver the baby? 3 stages. The first one, they really look like colicky animals. So they pace around, they are restless, they pace around the stall, they might paw, they might sweat. And those are normally the initial uterine contractions. And this stage can vary a lot in terms of how long it lasts. It can last between 30 minutes to 6 hours. It can last a very long time. So it's a little individual. If you know your mare, the mare had babies in the past, you will see that you might recognize a pattern in terms of how long the stage 1 will last. Stage 1 has to proceed to stage 2, and stage 2 is the critical stage when there is the rupture of the chorioallantois, which is the water bag where the baby is kept in the uterus. So you have water break, and then you proceed all the way to delivery of the baby, so expulsion of the baby, and that should not take more than 20 to 30 minutes. And this is very important, and the reason why we're so worried that this should take this amount of minutes is because the equine placenta detaches very readily, and so the foal normally doesn't have oxygen at that point and doesn't survive extended labors. So this is a very critical point where if you detect a problem, you have to intervene promptly. And then in general, you can see it's pretty fast as a parturition in terms of stage 2, going from the water break to delivery compared to other species. So when problems occur, you have to be, again, ready very promptly to intervene. Otherwise, they can really end up in a train wreck, in very, very big problems. And then stage 3 instead is basically the passage of the placenta, so the afterbirth, that needs to happen within 3 hours. And for horses, it's critical that this happens within 3 hours. Otherwise, we call it a retained placenta and can bring a lot of problems to the mare. So this is just to kind of go through the 3 stages of labor. And this is just showing stage 2. And stage 2, you see something normal here. So they are the legs sticking out with this kind of translucent yellow whitish membrane that comes out. The mare is restless, it's painful, there are big uterine contractions. And this is the stage that should not take more than 20 to 30 minutes. And when you're there, what you can do is monitoring that there is progression of the foal. And obviously, if the vet is not there and you have never seen it, never done it, the vet should be on the way at that point. Keep a record of the time. Sometimes, especially if it's your first falling, it's difficult, your emotions come into play, and it's difficult to know how long it took. So write everything down. So if you have you won't rely on your memory, and you have all the notes and you have detail of all the events that are happening. And then, in stage 1, you already wrap the tail. As you can see here, you already provided a deep, safe space where to fall. So you can just observe and leave the mare as quiet as possible at this point. Okay, so you might wonder, when do we have a problem? So if you are in stage 1 and you recognize that is not progressing well to stage 2, that is a problem. And if you are in stage 2, so the stage that I just showed you, and this stage is taking longer than 20 minutes. So from when the water breaks, you don't see a progression. So progression meaning you don't see the foal proceeding out, you don't see very big and strong abdominal contraction, then it's time to intervene and assess the posture to try to detect what the problem is, because as we said, it's a very fast kind of progression. And then if you see malposition, so down here you can see that this is a normal position of the foal. So front leg first, the hoof that looks basically on the floor, so the bottom is towards the floor, and then the head on top. This is a normal position, so what you should see first are the front legs and then the head. If you see that it's coming out hind legs first, or you see the front legs but there is no head for a very long time, then that's probably a malposition. So again, you should intervene, assess the position, and help the mare. The other very big emergency would be the presence of the red bag. So you saw in the video how the membranes are normally translucent and white and very yellow, very transparent. If you see something red sticking out at any point, that's called the red bag, and is basically a premature rupture of the chorioallantois, which means that the foal is detached from the blood and oxygen supply, and that is truly an emergency. So again, you're probably on the phone with your vet at this point, if the vet is not there, but is likely to tell you to open it immediately and pull the foal out, because in that moment the foal is asphyxiating. So that is one of the big emergencies to keep in mind when you are assisting a foaling. So immediately, once the foal is out, or once the stage 2 is proceeding well, then you can quietly approach the falling area and remove the birth sac. So here in this picture here, you can see the birth sac. That is a normal one, not red, but nice, translucent and very thin. In a normal progression, normally when the foal comes out, breaks the sac and doesn't have it on his head, just like in the picture. If you notice that the birth sac is on the foal's head, then you can go in and remove it. In less than 1 minute, you should be able to assess if the sac is on its head and remove it. And the big question that in that minute, once the foal is out, you have to answer is the foal breathing? So normally the foal should have very obvious chest excursions that you can see. So you see the chest going up and down. And initially, it will have some gasps within the first 30 seconds, but then it should take big breaths at more or less 60 to 80 breaths per minute. So you can understand that you will see these chest excursions very well. And that would be a normal foal. If you don't notice the foal moving at all and you don't notice chest excursions, that's abnormal. If you notice that the foal continue gasping for more than 30 seconds, that's also very abnormal. In general, when the foals come out, you see that they are responsive and they start, initially they don't move very much, but then the moment they come out, they start maybe moving their head and they look present. And again, you can see the chest moving very nicely. If that's not the case, that is abnormal. Foals that continue gasping, they don't have chest movement. If you put your hand on their chest, sometimes you can even feel their heart. If you don't feel any heartbeat, if you have a stethoscope, you can listen. Foals that have a low heartbeat or no heartbeat, they all require immediate resuscitation. And in that case, you will have to clear the airways. So approach it, clear the airways from any mucus or any substance that might be sticking to their nostrils. So they need to be patent for you to be able to intervene. And in terms of what you clean, the nose is the most important part because they are obligated intranasal breathers. So they breathe with their nose, not with their mouth. So we don't really care if the mouth is dirty. We care about if the nostrils are occluded with mucus or other substances. So in foals that have a problem, we have to know when we need to intervene. And this is a little bit something that, you know, your vet would be very comfortable doing, but there are some things that you can do while you wait for your vet that is now on the way, because you assess that your foal is not breathing normally and is not moving normally. So who needs CPR, cardiopulmonary resuscitation? And this is a nice algorithm that can explain to you a little bit on kind of how to intervene. So at this point, if you are here evaluating respiration, you know if the foal is breathing or not. So if the foal is not breathing, you can definitely take a heart rate. And again, you put if the foal is breathing normally, you can definitely take a heart rate and put it on your hand on the chest and feel the heartbeat. Very commonly, it's easy to feel. And I would say if you get to this point is because there is something that prompts you to go there. So the foal might be breathing well, but you see that he's not trying to position himself, he's not moving his ears, doesn't look present, might not have opened his eyes. So normally those are foals that are breathing, but are not as bright as expected at that point of birth. In general, more commonly, you will intervene if the foal is still gasping or not breathing at all, or not breathing appropriately. In both cases, what we are gonna do first is trying to ventilate this foal. So airways first. So try to ventilate, give oxygen to that foal is the first thing that you're gonna do. And then you're gonna do it for a few seconds and assess the heart rate and assess the respiratory rate and see if what you did was successful. So I wouldn't worry about this part of the diagram. I think for you guys that are assisting foaling, this is the most important part, and this is how to know when to intervene. And let's see how to intervene. So things that everybody can do, as we said, airways first. So respiratory arrest normally precedes cardiac arrest in the newborn foal and in large animal in general. So what we have to provide is ventilation. And there are simple ways to do it. Your vet will have an ET tube that will put in the trachea and will do it a little bit more effectively. But if you don't have that and the vet is not there, there are other simple ways that you can ventilate this foal or try to ventilate this foal with. So place the foal in lateral recumbency, just like in this picture, and extend the neck. And then you can see here what she's doing is basically breathing in one of the nostrils. So we said they are intranasal breathers. So she's breathing in one of the nostrils, occluding the other one, and occluding the esophagus with the finger, because what you don't want is to inflate the stomach. The esophagus is basically the canal that brings from the pharynx to the stomach. So you occlude it gently on the left side. It's very soft and it's very easy to occlude, just putting a thumb in this area behind the throat latch. And in the meantime, you try to deliver 10 to 20 breaths per minute. You can do it with this mouth to nose technique. If you have pump and mask delivery system, which lots of foaling facilities have, that's also a good choice. It's a similar principle, still occluding the esophagus to try to avoid to inflate the stomach, but just inflate the lungs. And this is what you can easily buy and have in your foaling facilities or at home. And you just put the mask on their nostril and then use the pump up and down to pump some, again, 10 to 20 breaths per minute. It's easy because you are very emotionally challenged in that moment. It's easy to overdo it. So be careful to try not to overdo the breaths per minute, because that can be, that can do worse than not providing the normal amounts. So if you are ventilating well, then you can assess the heart rate again. And if your foal is not having an appropriate heart rate, which is around 50, 60. We would like to see it above 60 when they're born. If it's less than that, and you are already ventilating, again, first step, then you can provide some chest compressions, just like you saw in the movie for people. So providing chest compression, remember someone is ventilating, so don't stop that. But if the heart rate is not appropriate after 30 minutes of ventilation, then you can do both, ventilate and do cardiac massage. The person performing the cardiac massage should kneel parallel to the foal spine, place his or her hand on top of each other, just like in the picture here. And then just basically behind the shoulder of the foal at the highest point of the thorax, right here, they should put pretty hard pressure. Now, you should have the foal on a flat surface and make sure that it's lateral, just like this. And again, this is a 2 people job at least. It's pretty hard to keep a good effective compression, so very often you need to switch every 2 minutes. We say that you should switch with something else, and you can switch with the person who is trying to ventilate the foal, and this helps basically deliver enough force. This is also a position that is very important because you need quite a bit of force to be able to deliver successfully the massage. You do need to try to deliver at least 100 beats per minute. So if it's difficult to know how much that is, it's definitely faster than your ventilating rate. You can follow the rhythm of staying alive. That's why John is here. So try to follow that rhythm and you will deliver more or less 100 beats per minute. Careful not to synchronize with the person who is giving ventilation, so is giving the breaths, because they are 2 very different rhythms. One important thing to check before you start is to palpate this area that you are about to compress and make sure there are no fracture ribs. If you feel like there is something that moves and a potential fracture ribs, then you have to switch the recumbency of the foal. So put the foal with the side of the fracture ribs on the side, on the ground, and start compression on the other side. There is this app online that is available, and everything is in there in detail, and it's a very nice app because it gives you the perspective of the owner and the perspective of the vet. So with different tools, what you can do. So I recommend you go and look online if you are about to have a foal, because it could be really helpful. There are pictures, notes, and all of that. So foals are not small horses. This is very important to know because there is lots of substantial physiological differences between a foal and an adult horse. In terms of what is different, practically, drugs that we can administer are different. The doses of the drugs very often are different. The tolerance of the drugs are different. And then also the causes of the diseases, the susceptibility to these pathologies is different. The processes and how the disease happens and how it affects them are very different. And then, if you imagine that they are preys, all the preys in nature have to make a very big transition between being in the uterus and being a newborn that needs to get up very quickly and needs to start running because they need to run away from predators. So there is a very big transition between a fetal life and newborn life. And in that transition is very delicate. And if there is any stress, any pathologies, anything that disrupts this transition, you can have very big problems. And sometimes some body systems can reverse to the fetal life, like the cardiovascular system. And you will see a very big problem. So very important knowing what a newborn does normally, to know what's abnormal, and to kind of be proactive and be able to act quickly. So priorities in your neonatal assessment is basically identify these risk factors. And we talked a little bit about what the maternal risk factors, so the fact that the vet should be involved to identify high-risk pregnancies, the fact that the fetus might have a problem, and that is a risk factor even before they are born, environmental factors, so the importance of a good environment. And then rapid recognition of abnormal behavior and abnormal signs in foals is very important to then have a quick action when the foal doesn't behave normally, because this is necessary to try to intervene as soon as possible. So you see how important it is to understand what normal is, to then identify what abnormal is, and then be able to recognize the red flags and intervene quickly. So just risk factors that I was talking about. So mare, difficult parturition, a mare that is maiden means the first foal, so has never foaled before. Mares that don't have a good maternal behavior, and we will see a little later. Mares that are sick, have been sick during pregnancies, previous history of having abnormal foals, septic foals, or having had problems with the parturition before. As in this picture, for example, this is a dystocia, which means a difficult parturition, because we said before, right, the feet should, if they are the front feet angled, normally they should be pointing down. So this is abnormal. That's one of the risk factors for having a compromised baby. Then fall factors that can develop pre-birth, so in utero as a fetus, or immediately post-birth. So failure of having that passive immunity that the mare will give the foal with the first milk, the colostrum, just like in human babies, that is a very big risk factors for problems afterwards. And then possible congenital defects, congenital abnormalities, those either congenital or acquired shortly after birth can be very big risk factors. And then again, abnormal behavior. Gestation-wise, mares that have twins, abnormal length, so premature or post-mature foals, or mares that have inflammation or infection in utero, so placentitis, can all be risk factors that you want to know. In these pictures here, specifically, this is a foal that is dysphagic, meaning that he cannot swallow. So this foal went to drink some milk and then puts his face down and the milk comes out of the nostrils. That's not normal, and that is a very big flag, and therefore you should be able to recognize, so you can call your vet for more assessment and try to understand why is the foal dysphagic and cannot swallow. And I'm sorry for the yucky picture here. This is a placenta. So the importance of evaluating the afterbirth, because this is a placenta. Normally they don't have this color. They normally are bright red in velvety inside where the foal was laying. And this is yellow greenish, and this is meconium stained. So meconium, we'll see later what it is, but the meconium basically should not come out of the body of the foal before the foal is born. In this case, if it does, then it's a sign of stress in utero, and the foal can aspirate it and can have very big consequences. So very important to recognize this as a risk factor too. So in terms of behavior, there is the 1, 2, 3 rule that is easy to remember, but is very, very important. So when a foal is born, and the foal is born, didn't need resuscitation, everything looked normal, within an hour should be able to stand. Truly, they start attempting within 30 minutes after birth, so even before 30 minutes, sorry. Normally, most foals by 30 minutes are already standing. So an hour is a generous kind of timeline because everybody is different, but they tend to stand in more or less ridiculous ways pretty much immediately. They have a suckling reflex within 5 to 10 minutes post-birth. So that immediately when they're born, they try to keep themselves sternal, so with the head up, they try to get up, and again, ridiculously, very often, initially at least, and they have very big and long legs, and it's difficult to coordinate themselves. And then they start trying to suckle everything with this nice kind of little noise that they make, and then they put their tongue at a spoon shape. So that is a normal foal with a normal suckling reflex. They truly will be able to nurse within about 2 hours. So they need to first be able to stand. Then a normal foal will have a udder seeking behavior. So will go exactly where it should go, so where the udder is, and that's something that they have in their instinct. And then by 2 hours, they should be able to nurse. And we'll see in a second how important this is and how we can assess if your foal is nursing appropriately. Then the 3 hours mark, the mare should have passed the placenta, very important. And then most babies should have passed the meconium, which is the first type of feces. This is not a hard 3 hours. Some babies take a little bit more. So the first few hours of birth are important for the meconium. If they pass it at 4 or 5, it's okay, as long as in the first few hours they start passing meconium. For urination instead, it depends a little bit on the sex. And within 6 hours normally for colts, if you have boys, if you have fillies or females, then they take longer, and it can be 10 to 12 hours before you see urination. And I just wanted to show you, so they should stand, and in these, you can see here how basically the foal is still wobbly, It's not fully coordinated and has other seeking behavior. You cannot tell from here if he's actually able to latch or not, but he's going right in the right spot there. So this is normal. This inability to coordinate themselves and stand, and the mare trying to lick and dry the foal. This is a very normal event within the first 2 hours. So this is very important. Rule number 2, nursing. How do I assess if he's nursing? Because I know he can go there, so he went to the right place, but you can't really evaluate if he's nursing appropriately from outside the stall. You have to go inside the stall and observe directly that the tongue seals around the nipple, right? Like in this picture here. So this would be good because you see that the nipple is in his mouth. You will see that he is actively suckling on it, and then you can see it swallowing at the laryngeal area. This is not an appropriate way to assess if he's nursing. You don't see if he's latched on. Sometimes they can be very tricky. They are right on the udder. They can make lovely nursing noises, but they are actually not latching on appropriately. So very, very important to evaluate it from on the other side, inside the stall. Visualize that nipple going into his mouth. Keep observing it until after nursing, because as we saw before, there are cases where there is abnormal milk coming from the nostrils. We call it dysphagia, when they are not able to swallow properly. So that is something very important to assess after they nurse. And then after they nurse, they literally nurse for a few minutes, a normal foal does, and they should almost empty the udder that was full initially. So assess the udder for emptiness. That's also something that tells you that the foal nursed enough. The rule 3, passing of meconium. So meconium is the earliest species of newborn foals, and it's composed of lots of intestinal secretions, some amniotic fluid that the foal normally swallows during the in utero life, and then some cellular debris. So a lot of things compose the meconium. It's sticky, caramelized appearance, like here, like dark fecal balls. And if the foal is not able to evacuate enough meconium, then what can happen is that the meconium can impact. We call it meconium retention or meconium impaction, that can lead to basically clinical signs of obstruction. So bloating, colic, and normally those are foals that show colic or bloating signs or dysposture when they are straining to defecate in the first 12 to 96 hours of life, and you don't see the meconium. So then you know, or you don't see a good quantity meconium. So you know that's probably the cause, and this posture is pretty suggestive of a meconium retention. So be careful, look for the meconium, look for clinical signs. Sometimes these foals are restless and they switch the tail quite a bit, and they again pause to strain to defecate. So be on the try to look for these signs if you are not sure if the foal passed the meconium or not, again in the first few hours of life. Another very important part of your post-foaling management is your umbilical care. Generally, it's not recommended to cut or break the umbilical cord. If it hasn't broken during delivery itself, normally it breaks when the mare or the foal gets up. So it all happens very naturally. The cord should break at the side approximately 1 inch from the foal abdomen. And this is where the cord diameter is a little bit more narrow. So it's narrower than the rest of the cord. So normally it breaks there. If it doesn't really break and you gave it enough time, then if it is necessary to kind of manually separate the cord, it should be held firmly in the either sides that you want to break, and then twist and pull to separate it, but never cut the cord. And the twisting and pulling, the reason is that you promote and stimulate the closure of the umbilical vessels that run through the cord and that might be still patent. And if you don't do that, it might be a cause of hemorrhage, for example. So there might be a little minimal bleeding. Normally it doesn't cause anemia, life-threatening anemia, so they don't lose enough blood to be concerned. If there is some bleeding, put gloves on and put a little pressure on the stump. So the stump is this region here of the umbilicus for a few minutes, and the bleeding should stop. Don't put any suture material, don't put clamps on there. The danger is that you put pathogens in there, so bacteria and dirt, and that can go into the umbilical stump when your suture is closed and then cause a site of infection that we will see is really dangerous in this baby. And then afterwards, treat the umbilical cord with an aseptic solution, the stump with an aseptic solution. Your veterinarian can recommend you the solution that they prefer. Normally, we recommend diluted chlorhexidine solution over some strong iodine. So it's a little bit of a dipping that you can do 2 to 3 times a day for the first few days. Very important to keep a close monitoring on the umbilicus for the first few days of life and even later. This is an example of an abnormal umbilicus. You see that this colt is urinating through his penis normally, and then there is some urine spilling at the umbilical level. It's very obvious. This is a patent urachus, and this is abnormal. The other thing that can happen is that they can develop infection at this side. Again, this is a part that is exposed to the world, so they can develop infection. They're called omphalophlebitis, and they can develop swelling, pus, like discharge from it, and they need to be addressed sooner than later. So that is something that you have to flag to your veterinarian if you see this happening, and that's why you should monitor it. The other thing, sometimes you can have big hernias, like in this case actually, where the GI content, basically all the intestine can fall into this little cavity here, and that's also something that requires veterinary assessment and attention. So how do I understand in my foal? Now my foal got up, or maybe got up, I don't really know. How do I understand if my foal is weak and lethargic? One of the hints that you might have is the presence of this eponychium. I'm not sure if I say it right, but that's the way I always said it. The eponychium is this basically soft rubbery layer of horn that protects in utero and in the birth canal, basically protects the mare, so the surrounding area, from the hoof, and then to ensure it doesn't cause any lesion on the viscera or the uterus itself. And then when they're born, when they stand, normally they shed it pretty quickly. And the foal has this membrane right here on all 4 feet. So it does have a purpose and is there, but should go away the moment they stand. So if my mare had a foal and I had no idea she was even pregnant, I get there in the morning, I don't know when the foal was foaled, but it's on the ground, and I wait and I look and there is some eponychium, and I try to get him up. It doesn't seem like he wants to stand. This is a sign that probably that foal never stood for a prolonged period of time. So that's a sign that there might be something wrong if the foal was born before an hour or so. There might be something wrong with the foal because it's lethargic, weak, cannot stand. Then normally a normal foals are very active, and once they learn how to stand, and even before, they are very active. They try to run away again. They're prey animals. That's what they do. That's their instinct. And when you enter the stall, they should go behind the mare and look at you. They're curious. They try to play with you, but they always should get up when stimulated. If you go there and the foal is sleeping, some foals are very cuddly and they might let you touch them and they don't get up immediately, but when you stimulate them on their back, they should get up. If they're unwilling to do so and they remain in this very sleepy and lateral position, that might be very abnormal. The other thing, as you can see here, this foal is at the udder of the mare. The mare is trying to stimulate him to nurse, but he's just staring at it. So being unwilling to nurse, and the back of the mare, so the udder of the mare in this case, might be very full, might be one of the other things that is abnormal. So foals nurse about 1 to 2 times an hour. So if that doesn't happen, that's abnormal. And then as well, they are pretty energetic after they nurse. They normally have a nap. They get up, they go to nurse, they have a pee, and they run around for a little while, and then they have another nap. They have a great life when they feel good. So if they are unwilling to stay up and explore, that's abnormal. If they are standing, they look very sad and dumping with the ears down and just staring at the floor, that's abnormal. And those are all cases where you should call your vet. Now, the other question is, can he stand or she stand up and get up and stand up for other reasons? So this foal seems very bright, wants to stand up, but then struggles a lot. And when he's up, cannot move really well and looks painful. So evaluating the limbs. So this is a case of contracted tendons, and it can be even much worse. And if it's way more contracted, they might not even be able to get up. So there is the will to get up, but they can't. This is something that you guys should recognize, and your vet needs to assess this immediately, because a foal that cannot get up is a foal that cannot nurse, and you can have very big problems with that. And then the same angular limb deformities. In this case, it's unlikely unless it's very pronounced that they cannot stand up, but they will be abnormal. And in order to be able to address them promptly, your vet should be warned immediately. So we talked a little bit about the colostrum. So the first milk, the thick yellow secretion from the mammary gland, present immediately after birth. You can see how different it is from milk. So you can recognize that the mare's colostrum from the physical properties is yellow and thick. And there are other ways where you can assess if your mare has adequate colostrum. One of them is the bricks. So it's this little tool, it's called the refractometer. You can find it online. You can put a little drop on these and it will give you a percentage. Above 30%, that's considered excellent, 20 to 30 adequate. If it's less than 20, is not good colostrum, meaning that there isn't a very good amount of immunoglobulin, antibodies, because what the colostrum does is rich in antibodies, and the foal nurse in the colostrum is going to absorb the antibodies, and the antibodies are fundamental for his immunity. So having a good colostrum is a good first step. Now we have to make sure that the foal is going to get that colostrum. If it doesn't, or if the colostrum is poor in quality, or if the mare had good colostrum but had precocious lactation and lost the colostrum, or if the foal is getting it but is not able to absorb it, so you see I'm listing a lot of things that can go wrong in this process, then they can have failure of transfer of this immunity. So failure of transfer of all these antibodies. And this carries a very big risk for developing serious medical condition in the short term. So if this baby that is just born doesn't get these antibodies, is gonna not have very much immunity, and is not gonna be able to fight all the bacteria, all the agents that he finds in this new world when it just came in. But also later, and this is a little bit of a complicated graph, but basically also for later, the foal will rely on this passive immunity that he got from the mare for quite a bit long time, from 6 to 12 weeks. You see in this moment, this is when he's going to produce its own antibodies. So if he's not protected enough, even around in this window of time where his own immunity is taking over and his maternal immunity is decreasing, he could develop medical conditions that could be serious. So very, very important to assure that the colostrum quality is good, that the colostrum gets in the foal, and then you will see your vet will have to ensure that he has enough IgG in the first 24 hours of life, meaning in that way we'll take a blood sample and we'll see why this is one of the things why it's important to have your vet out in the first 12 to 24 hours to assess if the foal has a good passive transfer, so if the foal has enough IgG. And this is a scheme to tell you that there is a way to fix that. So your foal didn't get good colostrum, your foal didn't get enough colostrum, or didn't absorb colostrum. There are ways to fix it. So foals can absorb IgG, so the antibodies from the colostrum, just for about 18 hours, a little bit up to 24, but the majority of it is between 12 and 18 hours. He's not going to be able to absorb these very big molecules. So it's very important that he gets the colostrum in this moment. And if I see that my foal didn't get enough colostrum because I measured the IgG, so the antibodies at 12 to 18 hours, and I know they are low, then I can still provide some oral colostrum from a bank, for example, and your vet again will be able to recommend you the product. If I measure it afterwards, then the gastrointestinal tract of the foal will not be able to absorb it anymore. And there is another way we can provide antibodies, which is the IV plasma. So there are ways we can fix that, but if we try to be proactive and prevent the failure of transfer of immunity, that is much, much better. Other things that can go wrong in this moment is the mom that doesn't really love the foal. So mothering behaviors are really important to recognize. And the 5 most abnormal behaviors that a mom could have is absence of bonding. So it's very unusual and abnormal if your mare stands on a side and doesn't lick the baby, is not interested in the baby, is not interested if you take away the baby. That's really abnormal. If the mare is extremely scared of the newborn foal. That's another abnormal behavior, can happen. Or on the contrary, if the mare is extremely overprotective and is very difficult to approach the foal because the mare is really, really overprotecting of the foal. Some of them don't let them nurse. They don't want them to approach the other, and you can see why it's so important for them to get the colostrum. If a mare reacts this way, then it gets really challenging for the foal to hydrate himself, get milk, and again get a colostrum with that very important immunity. And then there is the true foal rejection, where basically they are really, like the mare in this picture, they are really attacking him, and it's really dangerous for the safety of the foal. So those are like common abnormal mothering behaviors, and it's important to be able to recognize them because they really can lead to problems with the foal. Of course, the foal can be injured, and then if they're to a lesser level, the mare is just a little bit reluctant of nursing, this can lead to the foal not being able to hydrate himself, getting the milk, and get the colostrum. So very important to identify these behaviors. And I said not let him nurse, and we said before how important it is to check that the foal nurses and latches on very properly. It's also important to check and examine the udder. If my foal is on one side of the stall and my udder is dripping milk, like this one is very full, that foal has a nurse for a while. So if I want to make sure that the foal has an appetite and the mare lets him nurse, then I will scratch his back and hopefully he's gonna get up and go immediately to nurse. And after nursing for a few minutes, the udder should be nice and empty. So very important, the examination of the udder. When to call the vet. So anytime you notice something abnormal, so for example, the 1, 2, 3 rule is not respected, then definitely call your vet immediately. If the falling was unassisted, of course, if you had a problem with the falling, you should already have called the vet during the falling if there is a problem. Always call the vet within 12 to 24 hours of life for a checkup. And what the vet is gonna do with your foal is do a thorough physical exam, which means checking all the different body systems. So check the heart for murmurs, check the lungs, check the limbs, and assessing the ability of the gastrointestinal tract to work. So see if he passed meconium, if he's nursing appropriately, and then looking for congenital abnormalities, like could be contracted tendons, laxity. So all of the things that might not be that obvious and you might not have noticed, the vet can pick on that and try to address them sooner than later. Check the IgG, again, that immunity that gets transferred via colostrum. So take a little blood sample to check the level of IgG. And we said if they didn't have good transfer of immunity, then they can definitely, that can be sorted based on what time you detect that with either oral colostrum or some IV plasma. And then in areas like ours, where there is a lot of deficiency of vitamin E and selenium in the soil, we normally recommend to provide a shot of vitamin E and selenium to the foal when they're born in the first 24 hours of life. And then check the post-falling mare is also very important. So not only the baby, but the vet will check the mare, make sure everything looks good, check the placenta that you shouldn't throw away, but it's really important that you keep it because sometimes little pieces can be still in the mare and that could be a really big deal for the mare. So check your vet will take out the placenta, check that it's all intact, and make sure that the mare is also okay. So there are lots of, you can see that we have been talking for a while, there are lots of things that can go wrong in all these different processes and these adaptation to the normal life from the fetal life. And I just want to list a little bit the most common and life-threatening pathologies affecting the neonatal foal. And we saw some of the risk factors, and I just want to chat a little bit about the ones that are most commonly known and the ones that are most commonly seen, but there are way more pathologies that can affect our little babies. They are definitely fragile creatures. So neonatal septicemia is a biggie, prematurity, ribs, fractured ribs, the dummy foal syndrome that we also like to call neonatal encephalopathy. We already talked a little bit about meconium retention or impaction, neonatal isoerythrolysis, when the red cells of the foal react against the colostrum and the foal has a very bad reaction, they can be really sick. Bladders that are ruptured, so the foals that cannot pee and rupture the bladder. pneumonias, diarrheas, and there are way more potential problems. And if you can recognize what's normal in their behavior and what's abnormal, and you can warn your vet, the vet can come out and on his exam and blood work will be able to narrow down these possible pathologies and determine if there is something going on with your foal or not. So prematurity. So we said before, less than 320 days of gestation, the foal is normally not ready to come out, so they are premature. And normally these are the cutest foals. So you can see, this is an example. They are normally small in size. They have this fine, very silky coat, and their joint, very often they're weak little foals. They struggle to get up. Their joint and tendon are lax. They might not have enough bones because they didn't have time to form bones. On their x-rays, there is a very big empty space between one bone and the other. They have this like doom forehead and little floppy ears that they cannot keep upright. So again, they are the cutest foals, but they are abnormal. And it's important to recognize that they are abnormal. Some of these foals, like this one in the picture, the ones that have laxity and that might not have all enough ossification might need to be casted or heavily bandaged for them to be able to stand up. And in general, you know, these foals are intensive treatment, foals that require intensive treatment because there is immaturity in many, many body systems. One of them is, for example, the respiratory system. So there are changes associated with the immaturity of the respiratory tract, so they cannot breathe really well. Their brain is not set up to breathe well. They don't produce a substance that is called surfactant to be able, for them to be able to implement gas exchanges in their lungs. So they will require oxygen supplementation, potentially even mechanical ventilation. So they are foals that definitely very, very commonly need to be referred to a hospital and require intensive and prolonged treatment. So they can be very challenging cases. Now, another very big category is neonatal septicemia. Neonatal septicemia is probably the #1 killer of baby foals. And what this means is basically that there is systemic spread of a bacteria and or the toxins that these bacteria produce in the bloodstream. So these bacteria enter and seed in one of the body systems and then go around the bloodstream and distribute to the other body systems. Now, the entrance of the bacteria can already happen in utero. If there is a problem with the pregnancy, for example, like in placentitis cases, the infection can start even before birth or shortly after birth. Can start there and can seed in other places like the umbilicals, the lungs, or the GI tract. So you could see umbilical infection, pneumonia, diarrhea. You could see septic joints if the infection seeds elsewhere in one or more joints. The bacteria can also come in after birth and can enter the body via GI tract, so the intestinal tract. The umbilicus itself, so that's why umbilical care is very important, or other body system like the respiratory system. If there is infection somewhere, it's very likely that this will spread in a neonatal foal and will give what we call neonatal septicemia. A sick foal is septic until proven otherwise, because any source of infection anywhere in the body is likely that in foals, as I said, will affect other body system and will spread and cause systemic consequences. These foals might have a variety of severity and variety of clinical signs. In general, these are not normal foals. They don't do normal things. And one of the big things that we recognize is these foals are normally depressed, lethargic. They might have decreased or absent suckling. They might not want to get up. They might lie down more than normally. They might not be very active. These might progress to complete recumbency even if their heart pumps really, their heart rate is really high, their respiratory rate are really high. If you lift up and look at their gums, they're really dark and bright. They can have abnormal temperature. It might be fever, or it might be that they are really cold. So abnormal temperature either ways. And then sometimes we see other signs that are obvious, and they can be, and again, anywhere in the body. So from uveitis, so infection of the eye, to diarrhea, respiratory signs. These foals can even have meningitis. So the infections goes all the way to the central nervous system, and they can have seizures. So variety of severity, variety of clinical signs, treatments, and we'll see a little later. Normally, for the majority, depending on the clinical signs and depending on the severity, very many of these falls require intensive treatment, and very many of these falls, especially the most severe, moderate to severe presentation, require hospitalization. And one of the, you see, I have some pictures here. There's some falls, these falls can be really sick and will need a lot of these falls. There's a lot of pumps with a lot of IV treatments. One of the mainstay in treatment is IV antibiotics to fight this infection, and then a lot of nursing care. So they can be very sick babies. Another big category is the dummy fall syndrome or neonatal encephalopathy. And there are kind of two causes of neonatal encephalopathy: an hypoxic or ischemic event prior, during, or after parturition, which means that there is lack of oxygen in utero, so before the foal comes out, during the parturition, so that's stage 2, or shortly after. So all the things that we talked about making sure that the parturition goes smoothly, the placenta looks good, all of these, if something doesn't check the boxes, it might be a cause of lack of oxygen to the baby, and this baby might have consequences shortly after birth. And these tend to be the most severe cases. There is another cause of what we call dummy falls, and there is this high concentration of neurosteroids. So neurosteroids are these hormones that keep the foal quiet during the gestation and delivery, so it doesn't, again, tear the dams, uterus, or other vital organs, and it's nice and quiet, and it's kind of sedated in uterus. And the foal remains quiet, but then when it transitions, in a normal transition, the concentration of these substances that keeps it quiet should decrease. And it seems like the uterine squeeze, when they come out naturally, contributes to it. And then the foal, this concentration decreases, and the foal is nice, bright, and active. If for some reason this doesn't happen appropriately, then we might have these foals that are abnormally quiet. Again, as per septicemia, even in case of dummy falls, depending on what's the cause of it and depending on the severity of it, we might have different types of dummy falls, a variety of clinical signs. The clinical signs might be mild, just like an abnormal behavior. Sometimes they like to go around the, wander around the stall. They might just be they might find a little difficult to latch and find the udder. They might need a little help. These can be in the mild cases. In the worst cases, they might be completely unable. They might not have a suckle reflex, unable to latch and nurse. They might be blind. Like this baby here, they can have substantial alteration of consciousness and be completely obtunded. They might not be able to ventilate, so their diaphragm and their lungs might not work appropriately, so they might need to be ventilated. They can have true seizures. So it can be, there is a spectrum of variety of severity of clinical signs, and therefore treatment can be intensive in the worst cases. And the worst cases can have prolonged hospitalization and very high cost, because again, these can be very sick babies as well. Fracture ribs, just to mention, because we talked about CPR, make sure you check for fracture ribs. They are common in difficult and traumatic births. So every time you have what we call a dystocia, difficult parturition, check for fracture ribs, because that's one of the times you will find them. Your vet at the 12 to 24 hours assessment will assess the number and the severity, palpating the chest. You can ultrasound them, like in this image here. You can ultrasound them and see the fracture here. So this should be continuous. This white bright line is the bone, should be continuous. And this is instead cracked. So there is a fracture there. Can use x-rays as well. Some of these cases, if they are non-complicated fractures, might be something that you can manage at home conservatively. Some of them instead need surgery. And then I just wanted to, as my last slide, to talk a little bit about what we do in hospital when we see babies that are sick for one or the other reason. So very often when we have neonatal falls that are sick, they are intensive cases, so they go in intensive care. And general supportive care that we might have in general, then depending on the problem, we might have targeted therapies, but in general, these babies that cannot drink, cannot eat, and might be dehydrated, might need IV fluids. Sometimes they cannot maintain their blood pressure, so they might need drugs to help maintain their blood pressure, IV drugs. If they don't urinate appropriately, we'll need to hydrate them and try to support their kidneys. Very often these foals have urinary catheters in, especially when they're recumbent, to ensure that their bladder doesn't rupture and they produce enough urine. A very big consequence of every foal that is stressed or in hospital or both are gastric ulcers. So gastroprotectants are one of the medications that we use very commonly, not only in hospital, but also in sick foals in general, even on the farm. If they don't eat, very commonly we have to pass a nasogastric tube and provide them with enteral nutrition. If that's not possible, because, for example, they have inflammation of their stomach or GI tract, then we'll have to give them IV nutrition. We talk about plasma when they don't have good transfer of immunity. That's also something that we might have to give as an immune protection. Respiratory support, ventilate for them if they can't, provide them oxygen. And then in neonatal sepsis, a big part of the treatment is IV antibiotics, and then a lot of nursing care. A lot of it is meant to be for sepsis and neonatal septicemia, but for all the other causes, dummy foals, foals that cannot get up, premature foals, it's a lot of nursing care. These foals cannot get up, cannot maintain their temperatures. They need to be flipped. We need to do physical therapy. We need to make sure they urinate, their catheter stays in place. So it's a lot of work to have a neonate that is sick in hospital. Therefore, prevention and early interventions are key for success. So definitely be able to recognize what's normal from what's abnormal, from the time where the mare is pregnant to the parturition to immediately after birth, and in the moments afterwards, and even later in the weeks afterwards is very, very important. And work well with your vet, establish this relationship with your vet, so then we can highlight and find all the red flags and try to fix them sooner than later. Okay, and now this is all I have, so I'm happy to take any questions. I can also stop sharing the screen.
That was
Thank
great.
you very much.
You're very welcome.
We did have questions kind of filtering in, but people are welcome to still put questions in the Q&A. Maybe we'll start off with a very straightforward question. What proportion of foal deliveries are normal, roughly?
Probably the majority of foal delivery. I don't have a number in my head, but I think the majority of them are probably normal. It's just the problem is when it's abnormal, it can go wrong really fast, and you have a very narrow window of time to fix it. So the more you're trained, the more your experience or experienced people are by your side, the higher is the likelihood that you are going to fix it and way less problems.
And maybe a straightforward one. She got us warmed up. They're just wondering what the vitamin E selenium shot is that you mentioned.
It's called EASY. It's a formulation. So there are different parenteral, which means something that you can give IM formulations. And it's something that, again, and this is when it becomes very important to work with your own vet, right? Because the vet will be able to recommend you and normally comes and does it at the 12 to 24 hours visit, the product that they like to use. But again, this is probably because I know we have people from different parts of the world related to the places where we have an established kind of deficiency in the soil of vitamin E and selenium. That's something that even if we normally recommend to test the mares during pregnancies and test them, the foals after they are born, but still supplement them because we are sure that they are running low normal levels of vitamin E and selenium, and it's simply a shot that the vet can give at 12 to 24 hours.
And how about someone was asking in regards to chest compressions, they wanted to know, does it matter what side the foal is laying on?
So it does matter if you think there is a problem with the ribs. So if you detect some fractured ribs, and you can detect them basically palpating they are pretty skinny when they're born, so you can palpate the ribs pretty easily. If you pass quickly your hand on the ribs and you find that there is a step or there is an instability, then you should not do chest compression on that side. You should flip the foal and do it on the other side. Flip it basically very gently, not to promote displacement of that fracture. The other part, if you have them on both sides, it becomes complicated. In that case, it's good to try to establish which side is the most cranial, which means closer to the face, because those are closer to the heart. So you should not do chest compression there. You should use the other side. Otherwise, it doesn't really matter as long as you provide compression with enough force.
Awesome. Thank you very much. And let's see. So there are also some questions about deworming mares before foaling, and also when you should deworm the foal itself.
And again, this is very important, and there are lots of geographical differences and lots of differences based on the farm history of type of parasites that they have. So this is where it becomes, again, once more, very important to work with your vet. In general, we do recommend to vaccinate pregnant mares, deworm pregnant mares close to the date, and every vet might have different thresholds, so I'm not going to go into that, but very important to have that relationship even before the foal is born. And then for foals, there is one of the two parasites that are important. One is transmitted by the milk of the mare, and the other one is something that they can develop in a little bit later in life, which is called Parascaris equorum. So often vets recommend to start deworming them when they are 6 weeks to a couple of months old, with some specific dewormers that are targeting that specific parasite. So oxybendazole, fenbendazole are normally the dewormers that are used at that age. And then once they become more like in the adult range, so yearling and on, then they go on the schedule of the other animals in the farm. But again, your vet might know better the history of your farm or the farms around you, and might be more able to establish defined protocols.
Awesome. So I wonder if you have any comments, general comments about sourcing colostrum, especially if there are issues with the mare potentially.
Yeah, that's a good question. So there are lots of farms, and again, if you are like a single person that is trying to understand, is your vet might have that idea based on where you are. There are lots of farms that store the colostrum and have bank of colostrums. Lots of equine hospitals might have bank of colostrums from mares that are vaccinated, and so therefore they should have good colostrum and good immunity, good IgG in that colostrum. So I would always reach out to breeding farms around you and again, your vet might be helpful with that, or equine hospital. They might have a good source of colostrum from other healthy mares that you can use if you think the colostrum of your mare is not adequate.
Awesome, thank you. Let's see. I think this person essentially was asking if you do end up having to give plasma to a foal, at what age is it? Is there an age where you would not do that anymore?
So not really. So it depends on the reason why you give plasma, right? If you are just trying to replace the IgG that the foal should have gotten and didn't have a good transfer of immunity, then as soon as possible, because you want to get that immunity as soon as possible. Now, septic foals, sick foals might have an initial good immunity, and then they will consume those IgG pretty quickly. So sometimes we recheck them even later in life, like a few days after, and we might have to give it later on in life. If we are talking about just hyperimmune plasma. So it depends really on the case, but normally if it's to replace that transfer of immunity that didn't happen appropriately, as soon as possible. Sometimes a liter is normally the unit that we use for a 50-kilo foal, but in some cases where there is a complete failure and there is absolutely no immunity transfer, we might have to use more than 1 liter. So in general, for this purpose, as soon as possible.
Awesome, thank you. Let's see, kind of along the milk vein here, someone's asking, can you feed foals goat milk? I'm assuming they don't mean as colostrum, but rather as a milk replacement.
Rather as a, I think so. I
don't know that one.
I think so. I've never personally used it. I think it's a possible choice. There are also many milk replacers that are commercially available that are designed for foals, and you can find them in tractor stores pretty easily. So I probably, would go there first. If it's a case of emergency once overnight, probably goat milk is okay. But I would probably recommend not to do it for a prolonged time and try to look for milk replacers that are designed for foals.
Awesome. Let's see, Sarah, am I missing a big chunk anywhere? I tried to copy and paste these all. Let's see. I think there was a little confusion with the red bag. Someone's asking if there is a little bit of placenta visible that looks, that you can see, but it is broken. Or do you have to be worried about that?
Normally don't see, so they are very different presentation. You normally don't see a little bit of placenta. What comes out is the amnios, and is normally very thin, very transparent. If you see something red, and a red bag is very visible, because normally it's a big balloon, red balloon that might be visible even before it comes out the vulva, just at the edge. So it's normally not a little bit, it's something very big. It's a red bag. It's a big red bag. So I doubt you're gonna have any doubt. And truly in a normal foaling, you shouldn't see anything red.
What about the contracted tendons question? I wondered that too. Is there anything
Oh,
that
yes.
can be done to prevent that?
Not really, because we don't fully know the cause. Sometimes in uterine growth can affect the way the baby's position and potentially having that, but there isn't anything specifically during the pregnancy that you can do to prevent it. And normally if it's congenital, they are born with that. So the moment you pull them out, that's what you notice. So there isn't much more you can do apart from, the techniques at the time of birth, and then immediately contact your veterinarian. Because as I said, depending on the severity, they might not be able to get up, they might struggle to stay up, and therefore they might not be able to drink, and that will promote for them to go downhill very fast. But in terms of prevention during pregnancy, not that I know of.
And then I think usually we try to stop by 7:20 so people can eat dinner, but and there are a few more questions. I think a lot of them would be good to talk with your herd vet about, your regular vet, especially because you should have a plan with them if you're breeding anyways. But if you have a question that you're having trouble finding an answer to, I think you can reach out to us and we'll try to get an answer for you if you're just having trouble. And sorry if we didn't get to a burning question you had. Feel free to reach out to us if that's the case. And then I think I popped the chat in the chat there, and so did Sarah, the link that we mentioned. So if you would want any input on our hospital tour video, please do share your thoughts with us, and we'll try to kind of tailor it to you guys a little bit. And we also have a kind of slate of speakers lined up for next semester. We always take a break in January. We'll start back up in February. Actually, I'll be the speaker then. We had to cancel last minute our November talk, and so we'll kind of rain date it for February. And then we have a cardiologist, a surgeon talking about castration, and I'm forgetting the other one. Ophthalmology.
Ophthalmologist.
Yes. So equine eyeballs.
Yep.
Heard it here first. And so we'll put those registration links up pretty soon. And I think that's all we have. Thank you very much, Dr. Delvescovo. That was really great talk.
I've copied down all the questions, and we'll try to get a few of those answers maybe in the follow-up email too. So, and feel free to reach out to us at the hospital at any time.
Awesome.
Happy holidays, everyone. Thanks for
Yeah,
joining
happy
us.
holidays.
Happy holidays. Bye.